The term immunity is defined as the resistance offered by the host microorganism for us. Immunity can be broadly divided into innate and acquired immunity. Innate immunity is the born resistance against infection that an individual possesses right from the birth, a unique property by which it can be differentiated by acquired immunity. A innate immunity acts in minute in the first line of those defense against immunity prior microbial exposure. मतलब पहले से exposure नहीं चाहिए. Diversity limited, non-specific and no memory. Mechanism of innate immunity. Mechanism of innate immunity following the exposure to microseveral mediator required at the site of the infection. The first step that takes place is attachment. जो पहला step होता है वो attachment जो involve करता है binding of the surface molecule of the microorganism to a receptor on the cell of the innate immunity. Example of surface molecule of microorganism include peptidoglycan and lipopolysaccharide. Example of host cell specific receptor include toll-like receptor. Components of immunity जो सब mediator immunity they वो सब exhibit करते हैं anti microbial activity by various means as described below. Some of them mediated they often act as a bridge between innate and example complement macrophages. Anatomical and physiological barrier, skin and mucosal surface, anatomical activities contribute to body temperature, pH, various soluble secretory product phagocytosis. Phagocytosis and neutrophil macrophages and monocytes are the main component of the immunity. ये सब required होता है for the site of function. Phagocytosis in 3 steps: engulfment, fusion of the lysosome, and microbial killing. Natural killer cell एक क्लास और एक तरह का लिम्फोसाइट है जो किल करता है वायरस इन्फेक्टेड सेल एंड ट्यूमर सेल मीडिएट मैकेनिज्म ऑफ किलिंग माइक्रोबियल डिस्क्राइब चैप्टर मास सेल these are present epithelial lining of the respiratory and the other mucosa. Innate immunity resistant to the infection and the individual possesses infection that occur during a lifetime. Immune response occur in minute occurs days में होता है minute occur in days which में prior exposure not required develop from individual exposure. Immunological memory response reaction response are present. Components of the innate immunity होता है anatomical barrier, skin, physiological barrier, phagocytes, NK cell, mast cell, dendritic cell, complement pathway where cytokine, T1 expectant, interleukin 6 acute phase reactants and components of the acquired T cell, B cell, classical pathway, cytokine, interferon. Type of it can be classified into active and passive immunity, artificial, natural. ये सब एक्टिवेटेड होता है बाय माइक्रोबियल प्रोडक्ट बाइंडिंग टू द टोल लाइक रिसेप्टर और बाय IgG एंटीबॉडी डिपेंडेंट मैकेनिज्म. This leads awareness cytoplasmic granules rich in histamine, prostaglandin, cytokine that initiates protecting dendritic cell. Dendritic cell they respond to cytokine that initiate inflammation. They also serve as a vehicle in transporting the antigen from the skin and the mucosa to the limb where they present the antigen to the T cell and dendritic cell. Bridge between dendritic cell जो act करता है the bridge between innate and acquired immunity. Role of the barriers in skin barrier prevent the entry, mucosal barrier prevent the entry of micro and producing mucus by the entrap. Normal flora, physiological temperature, low pH, normal body temperature, gastric mucosa, saliva, tear, gastric juice, trypsin, bile salt, fatty acids, spermine and lactoferrin. Complement pathway क्या होता है alternative and mannose binding pathway the chi mediator alternative is activated in response to bacterial enterotoxin where the mannose binding pathway stimulated by the mannose carotid receptor following inactive activation. The complement जो complement होता है mediate various biological lysis of the target macro stimulate inflammation cytoplasm are another bridge between innate and acquired immunity. Inflammatory response inflammation is defined as the biological response of the vascular tissue to harmful stimuli such as microorganism or other is a biological response to harmful stimuli such as microorganism. The major event that takes place during inflammation response microbes such as vasodilation due to release of vasoactive substances from the damaged tissue, leakage of the plasma protein through the blood vessel, recruitment of phagocytes, example neutrophil to the site of inflammation, phagocytosis under the following step: margination, rolling, extravasation, chemotactic migration to the inflammatory cell, engulfment of the microbes and dead material by phagocyte, destruction of the microbe. Inflammation is not always inflammation वो हमेशा प्रोटेक्टिव इन नेचर नहीं होता. समटाइम्स इंजीरियस कॉन्सिक्वेंसेज टू द होस्ट इन हाइपर सेंसिटिविटी रिएक्शन भी करवा सकता है. नॉर्मल रेसिडेंट फ्लोरा lining and respiratory tracts exert several mental they compete with the pathogen for the nutrient producing antibiotic substances, cytokine. In response to the microbial antigen, dendritic cell, macrophage, and other secrete several cytokine that mediates immunity such as tumor necrosis factor, alpha interleukin 6, A12, interferon beta, and transforming growth factor TG. Acute phase reactant is a protein होता है जो synthesized होता है by the liver. Acute phase reactant studies it, but their synthesis either increases or decreases exponentially during acute inflammation के समय इनका increase होता है decrease होता है. तो liver is the primary site acute synthesized by various other cells such as endothelial cell, fibroblasts, monocytes, and adipocytes. Positive APRs, these are the protein which level in acute inflammation में positive APR increase करता है. Cinnamon reactive complement protein, coagulase protein, example ferritin protein inhibitor, alpha-1 mannose. Negative APR, these are the protein जिसका level decrease होता है during and thus creating a negative feedback that stimulate the liver to produce positive. Example negative APR, albumin transferrin. Role of APR activities that contribute to the whole effect. APR has various anti-inflammatory activities. Example complement factor, metal binding protein, cancellation various. Example C-reactive protein. APR C-reactive protein example APR का that causes an acute inflammatory condition including bacterial infection. It belongs to the beta globin family. It precipitated with the C carbohydrate antigen in pneumococcus. However, not an antibody against the C-reactive pneumococcus, non-specific. It is one of the most common marker of the acute inflammation used in diagnosis. Following an injury confirmation, the CPR level starts increasing by 6 hours, double every hour. CRP level, the normal level 0.2 million, however, it increases by several fold. Insignificant increase of the CPR rate such as heavy exercise, common cold and pregnancy के समय इंक्रीज होता है. मॉडरेट इंक्रीज इट अगर इन कंडीशन such as bronchitis, cystitis, melanoma, pancreatitis, increase. CPRs can be detected by precipitation method using C-reactive antigen, latex agglutination test using latex particle coated with anti-CPR. It is most widely used method employed worldwide. Detection limit of CPR by latex extraction and highly sensitive CPR test. Minor quantities can be detected by various methods. Example nephelometry enzyme immunoassay. This is useful to assessing the risk to the cardiovascular disease. Acquired or adaptive immunity. Acquired is defined as the resistance occur foreign substance that are involved during the course of the life. Acquired immunity has unique property. Acquired immunity has a unique property in innate immunity. Mediators T cell and B cells are the chief mediators. Other mediator are classical complement, antigen presence, cytokine. Response occurred during the day. Acquired immunity involves T cell which takes several days to week, requires prior microbial exposure. चाहिए specific, highly specific होता है. Memory present. Acquired immunity does not have a memory component and does have a memory component of proportional following T diversity. Where acquired immunity takes time to develop in the active host cell receptor of the acquired immunity. Types of active and passive acquired immunity. Active immunity developed by an individual to an antigen stimulus. Here the host immune system is actively involved in response to the antigen, leading to the production of the immunological active T cell and B cell production of the specific antibody. Active immunity. Active immunity may be divided as natural active immunity, artificial active, develop exposure to vaccine. As a host immune apparatus, more active often fails to develop immunocompromise. Long lasting. Active immunity lasts longer. It may last longer. Certain it may include long influenza. It may also that is the patient becomes susceptible to microorganisms. This is called the permutation or contamination immunity. Type of immune response immunity vary depending on the micro. Primary immune response. When the जब antigenic exposure occur for the first time, the following events takes place. Latent period, effector cell, memory cell, antibody cell develop only after a latent period following the antigen exposure, which correspond to the time required to the whole effector cells. Majority of the activity T and B cells against the antigen stimulus become effector T and B cell, effector T cell, memory cell. Memory cell which are the key cells for the secondary antibody cell effector B cell produce antibody. Antibodies appear in the serum in the slow and sluggish manner, reaches peak, maintain the level. Secondary immune response when the same antigen exposure occurs on the enterovirus and which takes place of the following: lag phase IgM titer, negative phase IgM high titer. पहला MG महात्मा गांधी. Primary immune response latent period either absent or of short duration. This is because memory cell become active as soon as the antigen. Negative phase At the onset of the second wave, there may be a negative phase during which the antibody level may lower than it was before the antigen. This is because the exposed antigen combines with the pre-existing antibody. Called antibody surge, secondary antibody response on mainly IgG. Hence, it is said that the booster dose of vaccine are more effective. The difference between immune response are developed and passive immunity. It defined as the resistance that transferred passively to host in ready-made form without passive immunity. Natural passive IgG antibody transform mother to pit artificial develop and transfer commercially people immunoglobulin. Example, rabies immunity. Passive immunity plays a vital role. Immunodeficient individual as a host immune post exposure profile active and passive immunity develop faster. There is no longer on there is no immunological memory. The memory cell are not booster dose are not effective. The effect produced following subsequent immunology, primary immune response and secondary immune response. Slow sluggish promote powerful and prolonged lag phase, longer negative phase. Administration in the same as a certain bridge between innate and acquired. The innate and acquired do not work independently. They function in highly interactive collaborative manner, increasing each other's efficiency and producing combined response which is more effective than either branch produced by itself. Certain immune components play important role in both immunity and consider a bridge between macrophage and dendritic cells belong to the innate immunity system, but the antigen but they present the antigen to be more so macrophage is also antibody dependent cell mediated cytotoxic types of cell mediated immune response described which involve both innate and adaptive immunity. Cells of the innate immunity such as NK cell eosinophil destroy the target cell which are coated with a specific complement. Although the principal part of the innate immunity, the complement pathway can be activated by both innate and antibody. The classical pathway is activated by a target cell coated with specific antibody. However, activation of the alternate and the manus by the cytokines secreted from the cell of the immune can activate cells of the adaptive immunity and vice versa. For example, interleukin 1 secreted from macrophages activate helper T cell gamma. Other types of the immunity local mucosal is the immune response that is active at the mucosal surface such as intestinal, respiratory, or genital intestinal, respiratory. It is mediated by IgE antibodies such as secretin which prevent the entry of the microbes. In the local side, local immunity can only be induced by the natural live alternative. Example, following administration of the live oral virus or following IgE antibodies are synthesized and coated which prevents subsequent polymerase such as immunity does not develop following injection. Herd immunity defined as the over the community towards the pathogen. It plays a vital role in preventing epidemic. Would that mean the large population of the community immune towards the pathogen, hence epidemics are less likely to occur, and eradication of the disease may possible element that contribute to the development of the strong herd immunity. Occurrence of the subclinical cases in the herd ongoing immunization program. Herd structure, that is type of population involved, type of pathogen. Herd immunity may not be strong community. Herd immunity developed following the effective vaccination against some disease like diphtheria, pertussis, measles, polio, and smallpox.